What questions to ask before your procedure. Here to give us an insider's guide on what doctors do when they need care is neurosurgeon and scientist Dr. Rahul Jandial. Good to see you.
Hi, doctor.
Hi, good morning.
Boy, that's a good way to do it because, if you're going to surgery, ask a surgeon.
Yeah.
How do you do it? So we'll ask you, what do surgeons do when they go about looking for a surgeon?
Well, I got to tell you, people always ask me, like, what would you do it for your family? And I tell them, this is what I would do for myself. So this is my opinion. There are two concepts here that surgeons know, doctors know, that I think everybody should know. One is the word subspecialization, and the other is high volume. So when I look for a surgeon, if I needed surgery, I want somebody with additional training. Let me give you a specific example. After 4 years of medical school, I did 7 years of neurosurgery. Then I did another year of additional cancer training. Similarly, in orthopedics, after training in general orthopedics, you can subspecialize in joints. So that's the question you want to ask, because that's the question surgeons would ask.
Okay, so the idea of surgery can be very overwhelming. So walk us through the process, the logistics of how you'd be able to find a surgeon that works in a subspecialization.
Got it. So let's say you're seeing your general physician and you're talking about getting a knee replacement or a hip replacement or spine surgery. You would ask them to give you a referral. Mm-hmm. When you have that list of surgeons, you would call their office staff and ask them a very specific question. Is this surgeon subspecialized and, here's the buzzwords, fellowship trained? That additional year after is called fellowship. So that's something, you don't have to be in the awkward moment with the surgeon. The office staff can give you that answer. So these are questions you can set yourself up with, ask, and position yourself to the right surgeon just by communicating with the office staff.
And then the other thing that you talked about was high volume surgeon. What does that mean, and how do I find that out?
Right, so you don't want a jack of all trades, right? So you want, sometimes if you just need your tire changed, you go to Jiffy Lube and they do so many that they actually get better at it. You don't need to have somebody who fixes Ferrari engines take care of your tires. Similarly, high volume reduces complications, gets people out faster, their team is more organized, and when you call the office staff, you can ask them the same question. Is this surgeon I'm about to see high volume in this type of surgery that I'm being considered for? And they will guide you through that. They'll say, yeah, this is the person that does most of these for us. And that's another way you can get a sense of confidence you're going toward the right direction.
Okay, so let's say we found our surgeon who is high volume. And just to be clear, do you want someone who's high volume and subspecialized, or are those for two different procedures?
Point. You answered the question for me.
Okay.
So 3 things that are essential. It doesn't matter what surgery. We can't get into each surgery because every surgery is its own thing. But the 3 questions are fellowship trained. That means they're subspecialized. They got additional training. Number 2 is high volume. Did they do about 50 last year? And the third question is, will my surgery be done at their main hospital? Because they're covering so many spots. To get the A team that's going to make the efficiency, the scrubs, the nurses, the technicians, you want to go with the surgeon to their main place where they do that surgery. Those 3 things are the questions I would ask.
And clear this up for me. Some people think that when you go to surgeons, their sort of default position is, I can do that. Get in here and I'll do the surgery. And I had back pain last year. I injured my back and was really close to getting surgery, talked to a couple of surgeons. And one thing that I found refreshing was that both of them said, let's hold off. You're recovering. You don't need surgery right now. But people were saying to me, those surgeons are going to want to operate. Is that true?
Well, I think it's a nuanced question. Surgeons, if you ask them, how many of these have you done? Or are you good at this? Everybody will say, yeah, and I've done a lot. You want to drill down and say, to figure out their high volume. Because if you ask somebody, how many have you done? They might, give you the answer over the last 20 years, but they're not doing much the last year or two. That's where the specific question, how many have you done in the last year approximately? And if it's around 50, that means they're working on that part of the body about once a week, and they're in a rhythm with the surgery. That's the specific question to ask.
All right, doctor. It empowers the patient, all this kind of stuff.
Yeah.
We appreciate you sharing it with us this morning. Thank you. For more information